death as it will be a relief to me in the sense that my pain will stop. At the same time, there is no way I can leave my wife, children, extended family, and friends behind. A terrible.
Yes, it's an awful story, and chronic pain is just is one of the most unfortunate things that happen to us, and it does
changes our relationship to death, though.
Yeah,
I mean, when you're in that tunnel and you don't know if you're going to get out of it. I'm speaking personally here. You get the sense that it would be a relief just to get out of it.
Well, let me just extend that just a little bit, because there are some people that come to see us in therapy who have that sense. They have not chronic pain, it's a little different, but they have a lot of mental anguish, and they have the fantasy of suicide, of ending their life, and then they will be free of it. But there's an important point you have to think, because they have the fantasy that they were going to be in a state of existence free of this mental anguish. And that, of course, is the magical thinking that goes on. You have to help them understand that you're not going to be around to witness how you are without this kind of anguish. So that non-existence is non-existent. It's not a kind of existence where you suddenly are going to be free of pain. So I feel that one has to make the person aware of that as a way of kind of trying to deal and to prevent suicide.
And we'll move to more of your calls. Milton is next up. Morning.
Hi, good morning, sir. I just wanted to ask, I'm 23 myself. I'm a pretty young guy. And in fact, listening to your program, I pulled off freeway, had a walk in the valley near the Zampa Bridge in the Carquinez Strait. It's really pretty out here. But I wanted to ask you, is there any impulse among young people that you've observed that kind of reflects this tension or anxiety about death? I mean, sort of like an impulse, I guess, to make a name for yourself, to kind of achieve immortality in that way.
Oh, yes, there's daredevilry is one. I have a patient now talked about doing a lot of skydiving when he was 16 or 17 as a way of defeating that. But, we go back again to, I hate to keep working on this, but I almost wrote a novel about Epicurus. That's why I'm so interested in him. I didn't do it. But he says...
The Epicurus Cure? Or?
The Epicurus Cure, right. But he says, and it's true today, that, it's not that we have a lot of many of us don't have a lot of ongoing conscious anxiety about death, but we construct our lives in such a way that we're dealing with it. We try to dedicate ourselves passionately to becoming rich, to becoming famous, to become well known, to get larger and larger and larger, to chisel our names on the tablets of eternity. But in fact, all these are ways of kind of escaping the knowledge that we're mortal. And so that we don't live well because we're so obsessively concerned with greatness or with fame or with wealth. So I think that these are indirect ways, as you're suggesting, of dealing with mortality.
And we thank you, Milton, for the call. Here's a listener who says, it's not death that I'm terrified of. It's dealing with the death of those close to me. It's enough to drive one to suicide because as one who does not believe in an afterlife, I feel they are just gone from my life and I will end alone and unremembered. I won't even have a pet. I guess that speaks for itself. You also talk about in the book, though, it's like the old Lenny Bruce bit, the guy's in the ambulance and he's trying to grope the woman who is the paramedic or whatever because things have become so intensified. In fact, you used that example not from Lenny Bruce, but just in general. Heightens libido and sexuality certainly to face death and one's mortality, or can?
Yes, that is true. I think that sex... sexual and libido is a source of a great deal of vitality, and I have often seen people who are grappling with death suddenly also get an infusion of erotic desire. This story you're giving, I've heard it before from clients of becoming very sexually aroused, even in an ambulance, rushing them to the hospital. The comment that you're making about your being unremembered, if I were working and talking to you, I want to mention something else to you. I think help to take a good look at this whole concept of rippling, of being unremembered. But I think you'll find that you're passing other parts of yourself on to others, that there are people you know who take pieces of you into them. And if you feel that is not happening, well, this is a good time to start to help it happen. It's a good time to reach out, become more intimate, become more open with other people, with those about you. There are always going to be people in your life that you have contact with, that you leave something of yourself, even though not your identity, onto others.
Is there a danger, though, that it can be narcissistic and too self-involved? You know, you want to leave your imprint and you want to see rippling in others because it's sort of like Narcissus looking and seeing himself?
No, I don't think so, because I'm not thinking of passing on your personal identity. I'm thinking of you're trying to live a life of compassion and virtue, and through that helping others to live life differently and changing them so that they will change others, and you pass on this to future generations.
Let's go to Trish, our next caller. Good morning. Welcome to Forum.
Oh, hi. I wanted to ask Dr. Yalom if he could relate his current book topic to his Love's Executioner topic. I have in front of me Joseph Goldstein's book, Loving Kindness, where he quotes you, Doctor, that you don't like to work with patients who are in love because it's maybe because of envy. You too crave enchantment, and that the good therapist fights darkness and seeks illumination, while romantic love is sustained by mystery and crumbles upon inspection. And Goldstein goes on to talk about a kind of love that is not falling in love, but standing in love. And I guess that relates to my feeling of the only real anxiety I have about death that stays with me all the time is to make sure that I've lived and loved as well as I can.
Yeah, these are wonderful questions that you're asking. The idea of falling in love, not falling in love, but standing in love is, I love that phrase. Incidentally, that's a phrase from Erich Fromm in his book Art of Loving, which remains an extremely wise book. But the point I think that you're alluding to, too, is that there's so many different forms of love. And of falling in love, the idea of passionate, ecstatic love, where you've got a sudden crush on somebody else, you're obsessed with it. There is a kind of irrationality about that.
Can Freud call it a form of insanity?
Well, yes, you could call it a form of benign insanity, I think. Sometimes it's not so benign. But what happens is you are imbuing that person with features and aspects that, in fact, really aren't there. And when you suddenly fall out of love, you're saying, what was I thinking? Why had I elevated that person? And the other thing is you are giving that person so much power over you that if that person says something to you, you're elevated. That person that ignores you, you're suddenly in the depths of despair. It's, I think, very important that we begin to get the center of our own self-esteem inside of us. You know, it's a point that is age-old. I'm doing a lot of reading of Spinoza, and it's really right at the center of his philosophical thought that we do not place our well-being into others, that otherwise we're constantly at subject to the vagaries of others, and we fall up or down. Other therapists have used the idea that our thermostat of well-being is too close to the window, too close to the door, so that outside events make us feel up or down, and we really want to center our own self-esteem.
Irvin Yalom's book is Staring at the Sun.